Hello. Today we're going to look a little more closely at the concept of confidentiality. It is the central concept that governs the relationship between the medical professional and his or her patient. In fact, without exaggeration, one could call it the soul of that relationship. It's a long and practiced concept that stretches all the way back to the ancient tradition and the Hippocratic Oath, wherein the code will enshrine confidentiality in the relationship between the medical professional and the patient. Uh, it's found today in every professional code that governs the behaviors and sets the expectations for medical providers today. And it is where a patient is going to provide or share information to a medical professional with the expectation that that medical professional never divulges that information to any third party without that patient's permission. Uh, when we think about the idea of confidentiality, we're going to see that it's information that has a particular status. It's going to be seen as privileged, right? In that sense, the relationship is something that is held to the highest esteem. And as privileged information, it's going to be protected. And we see there's going to be challenges to this, particularly as we move towards a more electronical and digital storage of information, e-diagnosis, remote diagnoses, and these technologies, of course, are capable of being breached or hacked, putting confidentiality at a greater risk. Um, and there are going to be plausible exceptions to confidentiality too. Con- con- this concept of confidentiality may be overridden for and in the presence of certain mitigating circumstances. So, for example, to stop harm from occurring. But fundamentally, if we think about this privileged and protected private information, we'll see that confidentiality is one of the bedrocks of this fundamental relationship between patient and provider.